I totally agree. And one question I asked you, and I think this is a big question for a lot of people, is to do with the stigma. And in the Persian interview, I asked you this as well. And now I want to ask in English for our English-speaking viewers. So if someone is suffering from a mental illness and they have been diagnosed by, say, their GP or psychologist or psychiatrist, is it appropriate for them to keep it between themselves and their doctor? Or is it appropriate for them to tell some close friends and close family members, such as siblings and parents, or their wives or kids? Or is it better if they just tell everyone that I don't care about this stigma and I'm just open about it and I'm public about it? So what is the boundary when it comes to the privacy of such conditions?
Yeah, in the world of medicine, the number one priority is confidentiality.
Sure.
So basically everything is between you, your doctor, your insurance company, and any subpoenas from court. So basically it's confidentiality. What you say has to do with you. Now, number two, we always say if it affects the prognosis, the progress of the illness, making things better or worse.
Sure.
That's where the limit would stay. And another thing, in conditions that in psychiatry would be psychosis, severe anxiety in particular, or any other ones. Or in medicine, we talk about diabetes, seizures, things that can be very devastating if somebody's not aware around you.
Yeah.
Then we leave it up to you to let the people that really care about you know. But you have to understand that, people have mouths, and mouths are often unlimited. It's limitless.
Exactly.
There's no limit on it. It can come after you, it can bite you in the back later, and exactly. People use it against you, and we call you names, bully you with it, So a combination of all, confidentiality. Is it helping your diagnosis? Is it helping your treatment? Is it helping the course of your wellness?
Sure.
And the people that you tell, do they care about this? And it's going to be your number one responsibility to educate them about the condition.
Sure.
So for them to know how important it is,
Sure.
In America, for the past 6 months, it's been a thing that, if somebody tells you something, you take it more serious than imagine,
Yeah.
So if somebody tells you I can't breathe, I'm going to assume that they cannot breathe, I'm not going to say, oh, he probably needs to get some fresh air. That's not, there's no, so if I were to just simplify, because sometimes I confuse people, and I'm always confused myself anyways. So if I were to simplify it, I would say, educate your loved ones about it, and then inform them about your own condition.
Sure.
So this way, yes.
Yeah. You said it can positively affect the prognosis and the treatment of the condition if your loved ones know and are of emotional support to you. But we talked about in the Persian interview, and like you just mentioned now, your friend can be your friend today, can be your enemy tomorrow,
Yes.
And I personally believe that all of us, I believe in God, and I know you do as well. All of us, we have ourselves as a friend, God, and our parents if they are alive, and that's it, Yes. And anyone else has only limited sacrifice with you. In Persian, we say they might become halfway friend at some stage of the game.
Yeah. They become halfway friend, and you know what? It is you're a young, handsome fella. So I'm older, so I can give you that advice too. In today's world, those halfway friends are more frequent than they used to be. So you got to be careful. I mean, I have a psychologist friend that speaks sometimes, and he said one thing. He said something very beautiful. He goes, if you go into a house of 10 people at a party, and you're supposed to be there for 10 hours, for 1 hour, you have 6 minutes each to speak. Okay. Yes. And once you reach that 6 minutes, you better just be quiet and keep your mouth closed.
Sure.
Okay. Because after that 6 minutes, whatever you say can hurt you more than it can help you.
Yeah.
So yes, and yes, and it goes with illnesses, with secrets, with personal statements, anything you say. So back to the condition, which is more important. Let's say somebody has a condition of anxiety. They get into a large crowd, they get overwhelmed. I would tell my wife. I would, you know, urge my female friends to tell our husbands, you know, that, you know, watch out for me. You know, when I get into a house with like 50 people dancing, all of a sudden I get overwhelmed. I need to get out, get some fresh air. That's about it. You know, I mean, telling your friends is not only useless.
Yeah.
It can come back and bite you in the back. Like, you know, they point you out, say like, oh, she's crazy. You know, I mean, or label you with any name calling, you know.
Sure.
So use your discretion when you go public with privacy.
Yes, and yeah, like the other thing that you know, like we were talking in Persian in the interview, we said not everyone has the capacity to understand these things. And like you said, we have to explain to either if it's a close, like best friend or a family member, you know, mostly like of course your parents, if especially if they're educated, obviously they can understand more. But the thing is, with such conditions, so we mentioned in the Persian interview that in Persian, like they call these spiritual problems, you know, they say spiritual, whereas
they specifically say spiritual. You're very correct.
Yeah, spiritual. Yeah. So my personal belief, and this goes back to like what I believe and also what my religion believes, is that your soul and your heart, which I believe heart is the side that, you know, reflects God, has got nothing to do with the level of the happiness of your brain, because brain is part of our physical organ, like you said in Persian interview, is no different to any other brain organs, any other body organs, and any malfunctions in the neurotransmitters such as dopamine, serotonin, you know, noradrenaline, which in America you call it norepinephrine. So all of these can just affect our happiness, but that doesn't mean that the person is a bad person or they have got like a problem with their soul or they are not kind or something like that, you know?
Yes. I want to talk about, you know, I stand a medical doctor. That's about it. You know, I mean, I don't go into beliefs of, you know, ethical beliefs, or I don't go into religious beliefs, you know, because all you got to do is have a lot of respect, you know, because it could hurt a lot of people's feelings. Aside from that, your brain, yes, it regulates, it produces, and it stabilizes all of the neurotransmitters, of which are serotonins, different kinds, dopamine, multiple kinds, catecholamines, which include the norepinephrines and the epinephrines, and more. You know, there's more. You know, they control the physical work of your body as well. Sure. They control the physical. For example, if somebody's like super anxious, they might end up with diarrhea. You know, some people, when they're severely depressed, you know, I mean, there's a big correlation between depression and heart attacks, you know, and which has significantly and specifically to do with serotonin level. You know, there's a big correlation between anxiety and GI system being overworked. You know, a lot of people, when they get anxious, I mean, they just come out with all these GI disturbance. You know, we have anxiety of the GI, or which is correlated with anxiety, and they call it irritable bowel syndrome. Yeah. You know, so irritable bowel syndrome, specifically with people with OCD, with anxiety, they get overwhelmed. So your brain basically controls the rest of your body. You know, there is no person with you know, the cut of connection that can have a good heartbeat.
Sure.
Yes.
Yeah, and just I'm sure you and I know what that is, but just explain for the viewers, the GI is the gastrointestinal tract.
Gastrointestinal, yes. Yeah, everything that has to do with your stomach.
Yeah. So they call it in scientific terms a tube. So it's like a tube that goes from the mouth, you know, all the way to the esophagus and all the way to the rectum.
Everything that has to do with putting something in your mouth and your stomach.
Yeah. And they actually made them. There are only 9 machines like that in the world that they have actually like mimicked the gastrointestinal system. This big machine. I'm sure you've seen one in a museum. And there is only one in the southern hemisphere that is always in one place, and they don't move it from one museum to the other. And that's the one in the Mona Museum in Tasmania. So, the story of that museum is very interesting.
And you know, now that we talk about you know, and now that we talk about the digestive system, you know, the most common ischemia, which is, you know, which is blocking of arteries, you know, that can cause a heart attack, basically in the heart. It can cause a stroke in the brain. The most common ischemia of the arteries is not in the heart or the brain, is in the mesenteric arteries, which is around the intestines, you know. So that's very much affected in anxiety, you know. So yes, the brain controls everything, and any interruption or disruption in the signals from the brain can be devastating to multiple organs in the body. You know, the dopamine receptors, for example, the dopamine receptors, that, you know, overactivation of them can have a lot to do with schizophrenia, you know, and decrease of their activation can have a lot to do with Parkinson's.
Due to the stigma, and you know, in some cases, as I'm sure you are aware, and I showed this photo in the Persian interview as well, that when the level of the neurotransmitters in the brain is that much, you know, has changed by that much, it cannot just be changed by talking, you know. You need like medications to adjust the neurotransmitter function in the brain. So how would you advise those people? Like you said, obviously privacy is a big thing that can help to avoid stigma, but how would you encourage them to get help?
You know, somebody beat me to this statement. Somebody said this more than 2,000 years ago. You know, Aristotle the Great, you know, which was just a student of the school of Plato, said this years ago, thousands of years ago, that the first step towards a good treatment is a good diagnosis, you know, and to get to that, you have to see a professional, you know, and if you see the quality of life in other people's, you know, doings and daily chores, it can easily be yours. You know, all you got to do is just extend the hand, and it's only an asking hand, you know. So basically, to say in simple terminology is, you know, the help is right behind your door, even knocking on your door, you know. If you just let it in, you know, and you will see, give it a try. You know, psychiatry or psychology or behavioral science or neurology has never hurt anybody, because right at what you are unpleased with it, you could stop it. You know, but one thing that you could do is give it a try. You know, give it a try and see what a quality of life is waiting for you.